whether it's a city, our country that you're listening from, that would be great. And also to put any suggestions about any topics that you're interested in hearing about in the future. So we've got a health hour session today that's run by one of Manchester's very own Dr. Michael Sapong, who is an oral surgeon based in Manchester. And the topic today is going to be on oral health and overall wellness. I'm really interested in this. I actually love the dentist, so I'll be happy to hear some of the information that he's going to give us and some of the gems. So I hope you're looking forward to it as much as I am. But from anywhere that you're linked in, whether it's on LinkedIn, YouTube, Zoom, it'd be great if you could put any questions that you've got into the chat. Or afterwards, we're going to have a question and answer session where you'll feel free to ask Dr. Sapong any questions that are on your heart and anything that you want to get answers to today. So it's going to be great session ahead of us. So I just want to introduce Dr. Michael Sapong, who's going to give us a talk on oral health and overall wellness. Welcome, Dr. Sapong.
Good morning.
Good morning.
Yes, good morning, everyone. It's good to be here again, and this time we decided to focus on something different. Right, let me see. Today, we're going to talk about your oral health and how it influences your overall health. So what we're looking to achieve today, we'll have a bit of a chat on new trends in dental care. The WHO has come out with new ways of how they think dentistry should be conducted globally. We shall go back and, as we always do, have a focus on prevention, what we do as individuals to prevent dental disease, because that eventually is perhaps the most important part of the whole consideration. Then we will look at the links between oral and general health. These are things that, as dentists, we've known about for quite a while, but there's new information coming up which we really need to share with our patients. Then finally, I'll touch on something called the microbiome, which may be new to a lot of us, but really describes the bacterial and other microflora that inhabits our bodies and the role that it plays in regulating our health. So, my name is Michael Sapong. I'm a general dental practitioner. I have practiced dentistry for 30-odd years with quite a keen interest in oral surgery. So at the moment, I am practicing part-time, and I run a service that provides oral surgery on referral and sedation to patients all across Greater Manchester. I'm very keen that everybody should have access to safe dentistry. And I always say that I'm very proud to be involved with the activities of CAHN, which is an organization that is devoted to bridging the inequality gap in health access between Black and African communities and the general population at large. So that's me. Where's this? Oh, yeah. Okay, so the World Health Organization has released a document called the Global Oral Health Action Plan for 2023 to 2030. And within this, they intend to change globally how dentistry is run, the relationships between dentistry and dentists and patients, and also patients' role in the whole dental care process. So just a few details about this. Yes, dentistry is set to change. By 2030, the World Health Organization wants 80% of countries to have an operational national health, oral health plan or action plan. So they want everybody to have access to good quality dentistry. Oral disease has been recognized as the #3 most expensive disease, I think behind heart disease and diabetes. And well, yes, it's always true that the cost of prevention is significantly lower than the cost of treating oral health diseases. The document lists prevention, the concept of the mouth as a gateway to the body, the health and happiness of the individual, and the chain of self-care, the relationship between the patient and all the other healthcare providers as the 4 pillars for consideration for the future of oral health. So let's start with prevention. Prevention is what you do, mainly what you do in your homes.
Sorry, Dr. Sapong, sorry for interrupting you. Please, could you stop sharing your screen and reshare it again, because we can't see your presentation slides aren't moving in case you are.
Sorry, but I can on my side.
Oh, is it just, oh, okay, maybe mine's just stopped. Sorry, guys, sorry for interrupting. Proceed, sir.
Is there anybody else who's having problems? Yeah, right. Prevention is what we all do at home. Brush our teeth properly, brush our teeth regularly with a good soft toothbrush. Clean interdentally, clean between our teeth, either with interdental brushes or dental floss. Use a good fluoride toothpaste and a mouthwash where indicated. On top of all of that, then we also need to have a good relationship with our dentist and attend for checkups at the prescribed intervals. It doesn't have to be every 6 months. For some people, it can be more than 6 months. And for some people, it is less than 6 months. Now, all of these implements I described for use in prevention are also, thanks to technology, available electronically. And there's every good reason to investigate these. So electric toothbrushes, electric flossers, irrigation, water flossers, water irrigation equipment. Again, even if you're using these, remember to attend the dentist regularly and to use a good toothpaste. Central to all of this is that patients need to understand that prevention is always cheaper than restoration. So on an individual basis, if you can prevent the disease, you're far better off than having the disease and then having it treated. Put in numbers. In 2019, across the whole world, $387 billion was spent treating oral diseases across the whole world, 194 countries, which is basically every country in the world. It cost across the world $50 per person. And the estimate in lost productivity for that year alone was $323 billion. Big sums. Now, let's see what effect prevention would have had. If through prevention we had basically eliminated gingivitis for that period, the cost would have been 45% less. If you eliminate gingivitis through improved oral home care, then the estimate is that the incremental increase in healthy living years, healthy life years, would be 5.7 million every year for the rest, well, every year going forward. So it's quite a significant effect that proper oral care and prevention can have, even economically. So, central message: clean it right and keep it clean. Then all the pain, treatment, expenses, and time for fixing will be unnecessary, and we will all save a lot of money and time and become more productive. The key messages to take away are that, number one, oral healthcare industry is changing, and it is moving towards prevention. By 2030, 80% of the global population should or will be entitled to essential healthcare services. Now, this change will mean that the way you interact with your dentist will be different going forward. The focus will be on prevention. The focus will be on having a good mutual relationship with your dentist. So some of the many aspects of current dental work will either decline or disappear. The whole drill and fill and just attend every 6 months, and dentist looks at you and says, it's fine, go away. All of that is going to change, at least according to the WHO. Now, many dentists have already started working this way, and you probably find that these days you go to your dentist and the focus is on seeing the hygienist, and you also find that the hygienist fees have gone up because thanks to the focus on prevention, we're spending a lot more time. The hygienists are being tooled up more. And so the cost of providing hygienist treatment has gone up. And hopefully we find that in spite of that cost, we all end up saving at the end of the day. Now, links to general health, which is basically why we're here today, or what the headline says. We need to recognize that the mouth is a gateway to the whole body. And there's a strong connection between oral health and overall health. And more, scientists are finding associations between the two. It gets very technical in how oral health relates to general health. But very basically, whatever you eat goes through your mouth. So if you keep an eye on what you're eating, then straight away you're beginning to influence your general health. Secondly, there are two main types of oral disease, basically two main types. There's dental decay, which we all know about. So you have decay in your tooth, the decay is removed and a filling is put in, so on and so forth. And then there's periodontal disease. Now, periodontal disease is becoming more and more important in the practice of dentistry. Periodontal disease starts when you don't brush your teeth. So a film of bacteria and mucins collects around your teeth and your gums. If that is left, it produces inflammatory products, and you begin to develop pockets around your tooth, around your teeth. The teeth become loose, and the gap between the teeth and the bone widens. And through that, the inflammatory products of the periodontal disease, as it is now, are able to enter into your bloodstream. And of course, when they enter into your bloodstream, then they have access to the whole of your body. And that is where the problems and the associations begin. So let's look at a few parts of your body. Oral health can affect your brain. So if you accumulate the wrong kind of bacteria in your mouth, this bacteria can produce inflammation, like I just described, and that inflammation, once it enters your bloodstream, can get to the brain and cause either infections, because some oral bacteria have been implicated in Alzheimer's disease and dementia, and they can also cause neuroinflammation, where your nerves or your brain becomes inflamed. Oral health can affect diabetes. So again, the inflammation that you get from your periodontal disease can interfere with your blood glucose control. It also has links to your salivary flow and dryness of the mouth, which both are not good for diabetes. Tumors. Certain tumors, especially colonic cancers, have been found to be associated with bacteria which ordinarily would only be found in the mouth. So there's the linkage is that these bacteria coming from the mouth have an implicative effect on the initiation and growth of tumors. Again, the basis of most cancers is chronic inflammation. And while inflammation can be proven to have started in the mouth and entered the bloodstream through the gingival spaces, then there's a link between oral health and the initiation and progression of tumors. Nutrition, exercise, and stress management are the hallmarks of prevention of cancer disease. And of course, nutrition starts with what goes into your mouth or what goes into your body through your mouth. Oral health can affect blood pressure. So a healthy mouth and healthy oral flora, bacteria, viruses, and fungi, converts nitrates from the foods that we eat into nitrites, and nitrites in the blood are known to reduce blood pressure, lower blood pressure. Oral health can affect the risk of heart attack.
Dr. Sapong, ever so sorry to interrupt. We're still on the slide that says your oral health and your general health. Is that the correct slide?
So,
because some of our so our guests can't see the slides on the session.
oh dear.
I can see them, but it might be because I'm internal. Apologies, everyone, for the technical issue.
Okay, let's go to the chat and see where people left off. I've not been reading the chat. That's
yeah, no. It seems to be fine on YouTube and other social media. So it's a Zoom issue. Zoom has had an update recently, so it might be affecting things. Would you like to stop sharing and start sharing again, please? Let's see if that fixes issues.
yes. Okay. So let's go to new share.
If you can see the video now, could you please leave a thumbs up so we see that everyone is now connected?
I'm really sorry about this.
Absolutely fine. I really think it's a Zoom issue, Dr. Sapong.
Yeah, we can see the slides now. It's moving.
Okay. Can you see moving?
Yes,
Yes.
sir. Yeah. yeah, prevention and lovely images of people getting their teeth done.
Okay, so where do you want me to pick up again? Okay, let's go to links to general health. I think that's
is a good
yeah,
point.
that's why we're here. So yeah, like I said, the mouth is a gateway to the whole body. So let's remember that anything you eat goes through your mouth. So if you have a good sense of what you're eating, then it will eventually influence your oral health. Oral health can affect your brain through straightforward bacterial infection, inflammation, and these have implications on dementia and Alzheimer's disease. Blood glucose control in diabetes and xerostomia, that's dry mouth, affected by oral health. Tumors, so some bacterial infections have been directly implicated in tumors, and the bacteria that are implicated, well, the specific bacteria are typically only found in the mouth. Inflammation, and always remember nutrition, which starts in the mouth. Exercise and stress management are the hallmarks of cancer prevention. Blood pressure. The right kind of bacteria will convert nitrates from your foods into nitrite, and nitrite contributes to lowering blood pressure. I think this is where we were. So are we good? Are we okay? Are we okay with the slides?
Yes, everyone is putting thumbs up.
Okay. Okay. Right. So anytime there's inflammation anywhere in the body, there's something called C-reactive protein, which is produced to combat this inflammation. It's usually a good thing. But when you have a situation where the inflammation is ongoing all the time, chronic inflammation, and the C-reactive protein is produced all the time, then it can precipitate or it can influence your chances of having a heart attack. Dental calculus or tartar on your teeth, which is associated with chronic inflammation, has been shown to be higher in people who've had heart attacks than otherwise. So the link is beginning to be established between chronic dental calculus, that's poor oral hygiene, over a long period, and your risk of a heart attack. Oral health and pregnancy. Now, while the unborn baby is supposed to have their immune system shut down or inactivated. Now, when there's a pregnant woman with a heightened immune response can actually activate their baby's immune system. And when that happens, it has been shown to be connected to the development of cerebral palsy. So it's very important for pregnant women from this perspective to maintain the best oral health, best oral hygiene. And it says bacteria in the mouth can also lead to preterm birth, which can cause all sorts of other complications for the newborn child. So the key messages from this section are that the mouth is a gateway to the body. So for bacteria, it serves as a portal to the digestive and respiratory tracts. And if your oral hygiene is not very good, it does not only impact on your oral health, but it has effects all throughout your body. And the link between the mouth and the body is becoming more and more clear. And periodontitis, pathogens, bacteria, can be found in tumor tissue. Dental calculus is now becoming a potential predictor of heart attack risk. And bacteria are able to enter the bloodstream through the mouth and cause all sorts of effects on almost any tissue or organ that you can think of. Even arthritis is being linked to poor oral hygiene. So I think this has to be read as it is. So recognizing these undeniable connections calls for dismantling the barriers between medical fields. So up until now, people would see their doctor and they would see their dentist and keep them kind of separate. What the WHO is saying is that now all your medical care professionals should collaborate and treat the body as an interconnected organism so that the patients can get the best benefits of this medical attention, not only in terms of oral health, but overall health as well. Now, yes. I thought that I would introduce the concept of the microbiome. Perhaps I'm not even introducing it. Perhaps most people know about this already, but the microbiome is the whole collection of bacteria, viruses, fungi, all the microorganisms that live in and on our bodies. And it's a new concept, I suspect, for a lot of us. When you think about it, our bodies consist of 10% human tissue and 90% non-human cells. And these non-human cells will be viruses, fungi, and bacteria. Consider it as a secret organ or an invisible body made up of more than 10 million microorganisms. So each of us is walking around with more than 10 million of these microorganisms. And 10 million microorganisms, and there are more than 10,000 different species within this 10 million. What this microbiome does is that it regulates a lot of our body functions, and can eventually, especially when it acts well in the brain, can change your mood, can change your mind and your health. Your microbiome produces more than 90% of your body's serotonin, which has effects on, like I said, your mood and your mind, your well-being. Now, the choice of food that we eat can have a powerful impact on our intestinal bacteria, which is, again, where most of the microbiome resides, and the diversity of this bacteria. Now, the not hormones, the cytokines and the microfactors that your microbiome produces has a profound effect on how your body regulates itself, how you feel. Now, how do you influence your microbiome? When it's drilled down, the simplest and the best thing to do is to influence your diet. And in influencing your diet, the advice is to eat more fiber, consume less sugar and fewer trans fats, less white flour and meat. Basically, more of a vegetable diet than a meaty diet. And it's interesting how with almost every talk that we have, it all comes back to diet. You are what you eat. So something we need to watch. And at this stage, I always try and remind everybody about the Tuesday evening talks that CAHN organizes. And these are basically focused on nutrition and different aspects of nutrition and well-being. So I'd advise everybody to have a look at that. I'm not a nutritionist, so I couldn't comment too much on diet, but it has been shown that while your microbiome regulates and runs your body, your diet is the one big way that you can influence your microbiome in a positive way. Now, studies report that, so you ask yourself, if I change my diet, how long is it going to take to make a positive effect? And studies report changes within just 1 week. But if you're going to do that, then you also want to think about making a permanent change, not just a temporary one. Yeah, so again, some more functions of your microbiome. They digest fibers that our gut alone cannot break down, and they also help in synthesizing certain essential vitamins. Like I said, they manufacture about 95% of our body's supply of serotonin, which regulates our mood. Yeah, there we are. So always remember, a regime that combines oral hygiene with nutrition can definitely help improve cancer prevention as well. And that has been proven. Right. Oh, I didn't think it would be that quick, but it looks like we've come to the end of what I have for you for today. Hopefully, we've learned about new changes in dental care administration, how you are going to relate to your dentist in the future. We've revised our focus on prevention. We've looked at some of the links between oral health and general health, and also introduced ourselves to the microbiome and what we can do to influence it. This is just to suggest that if you make your teeth and oral care the top of your priorities, everything else good should follow. Tooth is king. Now, this has been a whistle-stop tour through the whole subject of how your oral health relates to and affects your general health. I'm always available to be contacted. That's my phone number and my email address. And yes, I was recently in Ghana, in West Africa. There are some beautiful waterfalls there. I would advise everybody and anybody who wants to see Africa to go to Ghana. It's a nice experience. May your life be blessed with a waterfall of possibilities. And yes, I think that's it. I am available for any questions you may have, not only relating to oral care and general well-being, but any aspects of dentistry that you may be concerned about. I think in the past, we've spent more of our time answering dental questions. So thank you very much for your time, and I hope I've been useful. Thank you.
Thank you, Dr. Sapong. Thank you for that insightful talk. We do have some questions coming in from different platforms. We have our first question that says, Dr. Sapong, what do you think about gum laser reduction to fix a slightly gummy smile?
Aesthetic dentistry. Yes, it's a discipline that has come a long way in recent times. Initially, there were problems with stability of the treatment, but I would recommend it if that is what you need. But underpinning any dental treatment should be excellent oral hygiene. Because if your oral hygiene is not good and robust enough, these things tend to relapse. And they can also be quite expensive. So please, oral hygiene, prevention, prevention, prevention. And then when you've got that right, you can put the aesthetics on top.
Okay, brilliant. We do have another question that's a bit about aesthetic dentistry as well. So any comments on getting veneers for cosmetic reasons? I have loads of teeth repaired and dental work is and the dental work is impeccable. But now I thought I might as well get veneers in all my front teeth. Basically, it's better to keep is it better to keep what I have or just go and change the whole thing?
A good question. I'm not sure where the decision to have veneers is coming from, but my advice would be to invest in a good thorough consultation. In that consultation, you will be advised of all your options, and depending on the options available and your personal preferences and your ambitions for what you want to do with your future, you can choose. Certainly, yes, veneers are one good way of altering your smile. They will involve shaving down a little bit of your tooth and attaching something else on there. Sometimes the same result can be achieved with just braces. And these days, there are all sorts of clear, invisible type braces that you can have. Sometimes you may also find that what you have is just fine, but have a good consultation, and I would not be against veneers.
I've got a question in regards to veneers and braces. Is there a reason why in some people the dentist might opt for veneers over braces, or?
Yes, it's all a matter of like I said, assessment and investigation of options. Not everybody is suitable for braces. If you have your periodontal health is not very good to start with, then braces may not be the best thing for you because you might end up with nicely arranged teeth on a very poor base, which is just a recipe for failure. Veneers are a minimally invasive method of altering your smile. So sometimes they may be the choice for you rather than braces, and vice versa.
Got a question which I actually had a similar question to this. So in my country, the dentist is almost a luxury. How is it going to be accessible to all within our generation?
Well, the World Health Organization and its effect and influence on governments in their shaping of healthcare policy could go some way towards ensuring this. Eventually, you find in most places that dentistry is a fairly expensive engagement. And I suppose when economies improve, then it will become more accessible to more and more people. But with the WHO's plan, then focusing on prevention will mean that less and less people, fewer and fewer people need to pay large sums of money for corrective dentistry.
And leading on from that, is there any place in particular like we could look for places that would give us information about financial subsidies, like to access dentistry for all, or is there?
I wouldn't know much about this. The only thing I can, the only thing that comes to mind is NHS exemptions. So the government has exemptions for people on reduced incomes for NHS treatment. If you want private treatment, then again, the best advice is to, once you found a dentist, go on a plan. And some of these plans will give you discounts on certain treatments and make life a bit easier.
Okay, brilliant. Okay, so we've got the NHS exemptions, and obviously, if you want to go private, to go on a plan. Okay, so got another question. Why in the UK white filling is so expensive? Silver filling should be a thing of the past, they say.
Oh gosh. Now you want me to start talking about NHS dental health policy. White fillings are, by their very nature, more expensive than silver fillings. The NHS prescribes a filling for their patients. The NHS does not make any great distinctions generally on what filling should be placed in your mouth. It is sort of accepted that at the front of your mouth, the fillings have to be white. But when you start going into the back of the mouth, then dentists are able to place silver fillings. And of course, always remember that dentists are also running a business. So they will seek to place what can do the job for the lowest cost. And that tends to be your silver filling. And that is why a lot of dentists will say to you that silver fillings, well, white fillings on back teeth are only available privately. They are only under obligation to the NHS to place a filling that works. Does that help in answering your question?
Well, from my side, I think that does make a lot of sense, actually. Okay, so it's about basically making a standard for all people that is at the cheapest rate, but that works. Kind of.
Okay. Anything else?
Got a question. How often should we get a checkup and clean? Every couple of years?
Traditionally, and for a very long time, dental patients were supposed to attend every 6 months. And so people just went on a treadmill, 6 months, 6 months, 6 months. But the new recommendations are that you see a dentist, and based on the outcome of your consultation, your recall interval is decided. So some people see a dentist and they go back every 6 months, well, every 3 months to start, because their dental condition requires a lot more monitoring. Some people will go every 6 months, 9 months, 12 months, 15 months. And the maximum recall interval that the NHS allows is 24 months. So it's different for everybody.
Right. So it varies from person to person.
Yeah.
Got
But certainly, like I said, if you've not been in 24 months, then you're not doing something right.
Okay. Noted. So we've got a question here. It says, thank you, doctor. What advice can you give to those maybe older people from developing countries who didn't have access to dental care growing up? Maybe those who grew up in deep rural areas and didn't have personal toothbrushes until after migration to Britain, now needing to try to have good oral health after early damage has been done.
Yes. Unfortunately, the damage that has been done cannot be undone. But find a dentist and establish a good working relationship with your dentist. And over time, you should be able to repair, well, not so much repair, but slow down the decline and bring it into the levels of the normal, the average. It's very much like smoking. So if you look at it that way, somebody who's been a chronic smoker all their life decides to stop smoking, they need help with going down the right path. So all is not lost. And once you've established a good standard of oral health, then there are all sorts of interventions that can help you make up for the lost care. And that's where the restorations, the crowns and the bridges and the implants and things like that come in.
We've got a few more questions coming in.
Yeah,
can anything be done about receding gum lines?
Yes. You need to look at what causes your gum lines to recede. And basically, it's a few things. Aging will cause your gum lines to recede, just like you get gray hairs. Sometimes there's not much you can do about that. Toothbrushing. So the method of your toothbrushing will influence the recession of your gum lines. So if you brush with a hard toothbrush, it will cause your gum lines to recede quicker. If you brush with a back and forth motion, that will also cause your gum lines to recede, because when you come to the tooth gum junction, the gum is soft and the tooth is hard, and the brush will preferentially wear away on the gum, push the gum further back. If you brush with a scrubbing motion, that tends to help you maintain and massage your gums. The perhaps most important reason for receding gums is gum disease, periodontal disease. Periodontal disease will always produce inflammatory factors, and these inflammatory factors will cause the gums to recede. So again, it comes back to where we were before: prevention, 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 and the establishment of excellent oral health.
It's got a running theme of prevention in regard.
Prevention, yes.
Yeah. Got a question here that says, what can I do seeing my top front teeth and lips aren't aligned?
It's difficult to comment on that, seeing as we cannot exactly see what this patient is presenting with. But it's, again, a matter for consultation with the dentist.
Yeah. Okay.
And yeah.
Okay. What is your take on coconut oil pulling as a preventative measure and maintenance on oral hygiene?
Coconut oil what?
Pulling.
Pulling.
Mm.
I'm not sure what that is.
Yeah.
And I really couldn't comment on the effect of coconut oil in the mouth. I couldn't say.
Yeah. If the person who asked the question, you could put some more details in, and that would be great for us to understand a bit more about what you're asking. And we've got another question here that says, I had my teeth whitened with a home kit from the dentist.
Mm-hmm.
Since then, my teeth are quite sensitive. Mm-hmm. Although I'm not overusing the kit, do you know what else could be causing it? Does teeth whitening cause your teeth to thin?
There are different ways of whitening your teeth. I assume that what this person is talking about is that they had some trays made for them, and they put gel in the trays and wore the trays either overnight or over an extended period of time. Anytime you go to whiten your teeth that way, it makes your teeth sensitive. Now, depending on how often you do it and the strength of the gel that you're using, and also depending on your own personal susceptibility, the sensitivity will be clinically significant or not. In any case, if you find that your teeth are sensitive with tooth whitening, first thing to do is stop. And very often the teeth recover. So you stop, you avoid anything too hot or too cold for a period, and the teeth should recover. If you want to help the process along, then with that same tray that you put in the sensitive gel, sorry, you put in the whitening gel, you can put in sensitive toothpaste and wear that overnight. And that will also help to desensitize your teeth.
Okay, brilliant. We've got a question that's probably all on our minds when we go to the dentist. So when the dentist is checking your gums and says it is at level 1, 2, 3, what does that mean?
Oh,
Yeah, I'm sure we're all thinking it.
these are indices that we use to assess the severity of pocketing around your teeth and your gums. Level 1 would tend to say that it's normal. I think that's 1 to 3 millimeter pocket depth, which is not a problem. Level 2 is a bit more severe, needs treatment. Level 3 is a lot more severe, needs more comprehensive treatment. So they're just a way of assessing your treatment need. Again, I'm not really sure where this person is coming from, because the level 1, 2, 3 can be applied both to the pockets on the side of your teeth and also to the mobility of your teeth. Again, yeah, I think when you look at orthodontics and you look at the relationship between your top and your bottom jaw, there's also a level 1, 2, and 3 classification within that. So it could mean all sorts of things, but it's just, these are all indices used to assess your treatment need. And treatment regimes have been devised based on those.
I'm sure that answers some of our questions about what's happening when we're in the dentist. So that's great. I've got another question. Are electric brushes better to use than standard brushes?
The gold standard is good, is 1, a good technique, and 2, a good toothbrush on a manual, a manual toothbrush with a good technique. You can't beat that. Electric toothbrushes have been improving all the time. And today you have a situation where most electric toothbrushes are doing better than we can brush our teeth ourselves. But even in spite of that, the best toothbrushing will still be achieved with a manual toothbrush. So I suppose this is a bit confusing, but if you're going to go for an electric toothbrush, go for a good quality toothbrush and you should be okay.
A good quality toothbrush. Is there any particular good quality manual toothbrushes that you'd recommend?
Oh, I like a brand called Curaprox. I like a brand called Curaprox. They may be difficult to find, but otherwise, just go for any toothbrush that you're comfortable with. Just make sure that the bristles are soft, and also that when you finish cleaning your teeth feel clean. Ask your now this brings an ask your hygienist or your dentist to help you with that. And more importantly than before, cleaning in between your teeth has become a consideration. And if you notice, when I was speaking, I showed slides of interdental brushes and floss and dental irrigators and electric flossers, and those are things that I think everybody should start paying attention to. Mouthwash too.
We do have a question about flossing. So the person says that when they floss, their gums bleed. Is that something that they should be concerned about, and why is that?
Yes. If you floss and your gums bleed, it means your gums are not as firm as they should be. And what makes your gums not as firm as they should be is gum disease. So if you're flossing and your gums are bleeding, then it means you've gone past gingivitis and you are at the very best in early periodontitis, and you should see a dentist.
All right, and we've got another question. The questions keep on coming in. Can I check if there are alternatives to dentures? Is there any side effect of the gold-plated tooth?
Right, 2 questions.
Yeah.
There are alternatives to dentures, yes. Again, depending on your particular situation. So first of all, even within dentures, there are different kinds of denture. Okay, and some of them, because of their material of construction, can be very small and very discreet. Moving on from there, as an alternative to dentures, then there are all sorts. You could leave the space alone, which is something that a lot of people do and are comfortable with. You could have bridges, you could have implants as well.
Could have bridges or implants. I think that answers another question that we've got from another person. So is there any side effects of gold-plated tooth?
Yes, I forgot that. Sorry. No.
Oh, well, that's
So,
nice to hear, actually. Okay, no side effects from gold-plated teeth. Okay, and we've got a question, another recommendation question. So last time you recommended to have a toothbrush with fluoride always, and this is what I've been doing now. But do you
toothpaste
have
with
an
fluoride, yes.
brand you recommend? As now I'm conscious of chemicals on toothpaste.
Well, brand of toothpaste, toothpaste technology has gotten to the point where toothpaste, they're now like cars. So some people need a saloon car, some people need an SUV, some people need a truck, depending on where they are and what they're trying to achieve. Work with your dentist on that one. And if you find that it's your tartar control that is the issue, then you can find a tartar control toothpaste. If you find that it's sensitivity, then there are sensitivity toothpaste. But in the absence of that, most of the big manufacturers, so Colgate, Oral-B, they make they have toothpaste on the market which are sort of all-rounder toothpaste. So if you're not sure, then that's where I'd recommend that you start. And
Brilliant.
yes, fluoride is an essential prerequisite. It's something that you should look out for in a toothpaste, unless, of course, there are medical contraindications to your using fluoride, and these are very rare. So 40 to 50 parts per million of fluoride for an adult is fine.
When I was younger, I used to hear that they put fluoride in water. Is that still the case?
Yes and no. It's quite clear that fluoridating the water reduces dental caries, tooth decay, on a mass scale. So in this country, for example, the water in Birmingham is fluoridated. And you find that in Birmingham, the incidence of tooth decay is much lower than, say, a place in, say, Manchester, where the water is not fluoridated. Fluoridation seems like a good thing, but the pressure groups rose against fluoridation because it amounts to mass medication. And from a fundamental human rights point of view, you can't do that.
Yeah, makes sense. So I think we've run through all our questions. If there's any other questions, either feel free to put them in the chat now, or I think there's an email address that's going inside, that's in the chat, that you can send your questions to, so we can hear some answers and you can get some answers back from there. So thank you, Dr. Sapong.
Oh, it's always a pleasure.
I'm going to be handing over to Sam, one of the CAHN leads. Sam, about.
Hello, everyone. Thank you very much for that, Dr. Kemi. Thank you very much for that, Dr. Sapong. It's been a very interesting session. We always like it when you do come on here to educate us on, I'm just spotlighting. Yeah, educate us on oral health, which is, as you said, very key to life and very key to having a sustained, healthy smile. I'm just going to share a few slides with us. Bear with me. Share the screen. Okay. So thank you very much for joining, everyone. Next week, we'll be going through sexual wellness with Dr. Donu Barry, one of our clinicians, is going to come on here and talk to us about having good, safe sex, positive sex, body positivity, addressing sexual dysfunctions, and also consent and communication. We feel like this is a good session that everyone should be able to attend. Feel free to share about this upcoming session with your friends, family, and network. It's going to be the same link. It's going to be the same time, and we'll see you here next week. On Tuesday, the 17th of September, we'll be talking or exploring more on the healthy benefits of African and Caribbean foods. As you do or may not know, some of our foods can be quite heavy in calorie or quite heavy in oil. And during the session, our guest speaker, Dr. Hibbo, is going to go into detail on, making sure that our food's healthy and we maintain a very good balanced diet, because, we want to eat well and live longer and be healthy. If you're interested in research, especially when it comes to do our community, please do take part in this research with Decipher. It's a program where we're trying to encourage young ones, families, parents, guardians to educate their children on taking part in research from an early on stage, so that we can learn more better about sickle cell, learn better about thalassemia, learn better about diabetes from an early age. And feel free to take part in this research. It's free of charge. There's a lot of information on the link and on the QR code when you get there. And please feel free, if you have any questions, do contact CAHN and we'll be able to provide you with answers for any of these things that I'm speaking about today. Coming up next month, it's Black History Month. If you're unaware, October is Black History Month. We will also be having our gala on the 12th of October at the Hilton Hotel. Tickets are available, so please feel free to, again, scan this QR code, email us at bhm@cahn.org.uk, and yeah, invite your friends and family. It's going to be a wonderful day. It's going to be a wonderful evening. It's going to be 3-course meals there for those that are attending. There's going to be entertainment. There's going to be a raffle. There's going to be auctions. It's going to be a blast. And I'm sure that those of you that are going to get tickets will be having a good time. If you came last year, you had a great time. And the year before that, you also had a great time. So this is something we do annually. So feel free to share it with your network, and we would love to see you there while we celebrate Black History Month together. Not only celebrating Black History Month is happening next month on 12th of October, but we'll also be awarding people within the community that we feel are leaders, people that have contributed and impacted the community in such a good way that people's lives have been changed. So if you know anyone, or if you feel like you are that person, feel free to go onto this link or scan this QR code to nominate yourself or nominate someone within your network or friends and family that you think deserves to be recognized for their work that they have been doing. Do be aware that entries do close on the 20th of September. Not long left, but there's definitely enough time to fill out the form. And finally, Black History Month is next month. As we know, we have many people celebrate Black History Month in various ways, whether that's through events, through exhibitions, through talks. If you know any of those like you want to be involved in, or you want to share that with us, please feel free to scan this QR code or go to this link and fill out the form so we can get more people to be more aware about celebrating Black History Month in various ways. This is something that's going to be going on across GM. So if you know any events in Bolton or Rochdale, and actually not just in the GM space across the UK, feel free to fill out this form or go to this website QR code link and learn more about the events near you, because it's Black History Month. Let's support each other, let's celebrate together, and let's learn more about the Black culture. Thank you very much for listening. Thank you very much for joining us today. We really do appreciate every single one of you tuning in on a Saturday morning to learn with our doctors. If you do have any questions, there's an email that was put in the chat, health@CAHN.org.uk. Feel free to email that account and we'll be able to answer as many questions as you can in relation to health.
Sam, would you invite all to the launch event as well?
Yes, 100%. We have a launch event on the 25th of September, which is a few weeks away. That's happening at the Manchester Cathedral. Please feel free to come. It's free. It's going to be in the evening from 6:30. We're going to be launching Black History Month in GM, and it's going to be a day where we can network with other people, where we can see some live shows. Don't want to give too much away what to expect, but it's going to be a great evening. And feel free to come down, Manchester Cathedral. So follow us on socials as well. We'll be able to share more information on there, and I'm sure that it's been put in the chat as well. So yes, thank you very much, everyone, for tuning in today. Finishing just a little bit early, so you get a few minutes back on your Saturday morning. And yeah, we'll see you guys next week, where we're going to be learning more on sexual wellness. Thank you.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.